All right, so this is going to be a video, a 5-minute professional poster presentation. So to begin, my name is Astrid Moyes, and today I'll be presenting my evidence-based practice project titled Reducing Hospital Readmission in Patients with Heart Failure. Most of it was through remote monitoring. The purpose of this project is to examine whether nurse-led remote patient monitoring programs can actually help reduce and prevent 30-day hospital readmissions among adults with heart failure following hospital discharges. Heart failure is a significant healthcare problem and a concern. It remains one of the leading causes of hospitalizations and 30-day rapid readmissions among adults, especially older adults and individuals with multiple chronic conditions. Frequent readmissions contribute to increased morbidity, mortality, decreased quality of life, higher healthcare cost. Traditional post-discharge care often depends on scheduled outpatient appointments, which may delay recognition of worsening symptoms. Patients with heart failure may return to the hospital because of inadequate symptom monitoring, poor medication compliance, insufficient discharge education, delayed clinical intervention. My project addressed this gap through remote patient monitoring. Effects of the population and the nurse practice. The population for this project included adults with heart failure who were discharged from acute care hospital and are at increased risks of readmission. Expected benefits included fewer 30-day readmissions, early identification of symptom deterioration, improved medication adherence, increased patient engagement and self-medication, improved quality of life, and reduced emergency department utilization. This intervention also expands the nursing role. Nurses can remotely monitor patient data, provide ongoing education, reinforce medication and adherence, recognize early symptoms of deterioration, coordinate multidisciplinary care, and improve quantity of care. Nursing support therefore continues after the patient leaves the hospital. Evidence-based practice interventions. The evidence-based intervention proposed in my project is a real nurse-led remote patient monitoring, or RPM program. Patients would complete daily monitoring of their weight, blood pressure, heart rate, oxygen saturation, and symptoms. This information would be transmitted for a nursing review. If abnormal findings or concerning changes were identified, the nurse would be able to intervene earlier. Before the patient's conditions become severe enough to require emergency department visit or readmission, the program also includes comprehensive discharge education, medication reconciliation, scheduled follow-up communication, and collaboration with cardiologists and primary care providers. The project is guided by the Iowa model of evidence-based practice, which provides structured approach for translating evidence into clinical practice. The literature supporting the project. The literature reviewed for this project supported remote monitoring and structured follow-up for patients at risk for readmission. Colleagues found that remote health monitoring reduced readmissions among high-risk post-discharge patients by supporting early identification of clinical deterioration and timely intervention. Additional literature suggests that telecardiology and remote monitoring can improve medication adherence while reducing readmissions and mortality in patients with chronic health failures. Nurse-led education combined with structural discharge planning can also improve patient self-management and decrease readmission rates. Overall, the evidence shows that remote monitoring works best when technology is combined with nursing assessment, education, follow-up, and an interdisciplinary collaboration. My PICO question. The PICO question guided my project is, in adults with heart failure following hospital discharge, does remote patient monitoring compared with traditional outpatient follow-up reduce 30-day hospital readmission? This question focused on whether adding remote monitoring during the transition from hospital to home can produce better outcomes than traditional outpatient follow-up alone. Implications and recommendations. There are several important implications for nursing practice and healthcare organizations. Remote patient monitoring may reduce preventable readmissions, improve patient safety, enhance patient engagement, strengthen transitional care, and improve medication adherence. It may also increase nursing efficacy by allowing nurses to provide proactive rather than reactive care. From an organization perspective, reducing preventable readmissions may improve quality metrics and support value-based healthcare initiatives. Healthcare organizations should consider incorporating remote patient monitoring into discharge planning for eligible patients with heart failure, while providing standardized nurse-led education and interdisciplinary follow-up. So in conclusion, heart failure readmission continues to create significant challenges for patients, nurses, and the healthcare organizations. Remote patient monitoring does provide an opportunity to extend nursing care beyond the hospital and identify signs of deterioration a lot earlier. The overall goal is to move from reactive care to proactive care by recognizing problems early, supporting patients after discharge, and preventing avoidable hospital readmissions. So thank you for listening to my presentation. Thank you.